exercise and diabetes during pregnancy. So in previous generations, pregnant women were not encouraged to exercise. But in the past 30 to 40 years, extensive research has been undertaken, the results of which have dispelled some of the myths concerning exercising in pregnancy. There are many benefits of exercise in pregnancy, as well to women with diabetes in pregnancy. And although pregnant women are encouraged to exercise, the many physiological and anatomical changes that occur in pregnancy need to be considered. We will review these physiological and anatomical changes, the maternal and fetal benefits of exercise in pregnancy, contraindications to exercise, precautions, exercise prescription, and additional resources available at the end of the presentation. And according to the American College of Obstetricians and Gynecologists that were updated in 2009, in the absence of either medical or obstetric complications, 30 minutes or more of moderate exercise a day on most, if not all, days of the week is recommended for pregnant women. And I know in my own situation or own practice, the women who are exercising in pregnancy is a very small percentage in my practice. So we need to dispel myths regarding the benefits and risks of exercise for women who are pregnant. Some women and physicians are concerned that regular physical activity during pregnancy may cause miscarriage, premature labor, poor fetal growth, or musculoskeletal injury. For normal pregnancies, these concerns, however, have not been substantiated. Many pregnant women benefit from regular exercise, but the specific body changes that occur do have to be taken in consideration, and this is from the American College of Sports Medicine. And so the specific body systems that we need to consider and the changes that occur that do affect pregnancy include cardiovascular changes, respiratory changes, musculoskeletal changes, metabolic changes, and other physical changes, and we will look at each of these separately. The cardiovascular changes that occur include a decreased systemic vascular resistance due to an increased dilation and elasticity of the blood vessels, increased volume space of the circulatory system, increased placental circulation, which leads to a decrease in blood pressure until about mid-pregnancy. These changes result in vascular underfilling, causing the woman's heart to beat more rapidly to make up for the drop in blood volume. And during early pregnancy, her heart response is much higher than normal because of the body's attempt to pump blood out of the system. So her heart rate at this point in time, earlier in pregnancy, is higher with less effort. So changes occur to establish a circulatory reserve necessary to provide nutrients and oxygen to the mother and fetus. And as the pregnancy progresses, the blood volume increases to correct changes in the circulatory volume, causing cardiac output to rise. And you can see here there's an increase in chamber volume and stroke volume with an increase in cardiac output. The amount of blood pumped into the system is increased so the heart doesn't need to pump as rapidly to meet the exercise needs. And late in pregnancy, the combined effect of exercise and cardiac output make it difficult to get the heart rate in a target range as before pregnancy, even though she feels, or the pregnant woman feels, that she is working at a hard level. So therefore, for most women, heart rate is not a good indicator of how hard a pregnant is working. And later on in the presentation, we'll look at a better way to indicate a woman's intensity or exercise intensity in pregnancy. Some other things that also occur is some positional cardiovascular changes. And after the first trimester, the supine position results in a relative obstruction of the venous return and therefore decreased cardiac output. This results in pooling of the blood in the legs, a decrease of blood return to the heart, a fall in cardiac output, and resulting in hypotension. And this can lead to what we call the symptoms of supine hypotensive syndrome. And we can see here women may have some of these symptoms such as dizziness, pallor, tachycardia, sweating, nausea, and hypotension as a result of this. The supine position is related to a decrease in cardiac output in most women after the first trimester, and as mentioned, due to the side of the fetus and the baby's position. So the supine position is not recommended after the first trimester because it can decrease the maternal heart rate and oxygenated blood to the baby. The respiratory changes that occur include an increase in the progesterone, which increases the depth of each breath. So the amount of the air breathed increases by about 40 to 50%, and this maximizes the exchange of the oxygen and the carbon dioxide for the baby. So therefore, the woman's ventilation increases due to the increased tidal volume, which shows here, which is the amount of air that passes in and out of the lungs with a normal breath. However, there's an unchanged respiratory rate, which means the number of breaths per minute. So a woman is actually taking deeper breaths, but the rate that she is breathing is not faster. These respiratory changes make a woman feel short of breath, but her lung function actually remains normal. And because of the increased resting oxygen requirements and the increased work of breathing caused by pressure of the enlarged uterus on the diaphragm, there is a decreased oxygen availability for the performance of aerobic exercise during pregnancy. Later in pregnancy, a woman also feels short of breath due to the uterus displacing normal breathing space in the abdominal cavity. So at this point in time, a woman actually will feel out of breath at a much lower intensity. And so we typically would tell women at this point in time, we want to recommend that they stop exercising when they're fatigued and before exhaustion, but they may actually feel somewhat breathless when they're exercising. There's also some musculoskeletal changes we also need to consider. And these include softening of the cartilage. Also, the center of gravity shifts forward from the enlarged uterus, causing lumbar lordosis of pregnancy, which is the inward curvature of a portion of the lumbar and cervical vertebral column, also known as sway back. The breasts enlarge and can lead to rounding of the shoulders and increased hunching of upper back. This contributes to back pain that a woman may experience in pregnancy. And also due to the increased levels of estrogen and relaxin, there is an increase in joint laxity due to the relaxation of the ligaments, especially the pubic symphysis and the sacroiliac joints. And for women that this is occurring, we would recommend her trying to do stretches, stretching the chest, working opposing muscles, and trying to maintain good posture when sitting, standing, and doing any form of exercise. And just here's a visual representation showing where the joints and ligaments that are affected during pregnancy due to these hormones of estrogen and relaxin. Because of these changes, balance may be affected by changes in posture, predisposing women to the loss of balance and increased risk of falling. This makes activities like jumping, twists, turns, sudden starts and stops potentially problematic and could cause strains. In addition to this, back pain and potential balance problems can occur with weak and overstretched back muscles. And weight increases the force on the knees and hips by as much as 100% during events like running. And although there is no evidence or clear evidence that musculoskeletal injuries are increased in pregnancy, these possibilities should still be considered when prescribing exercises. And especially when we're dealing with women as the pregnancy progresses and her weight increases, also with overweight women, we really want to encourage lower impact exercises that lower these risks. Some of the metabolic changes that occur, there is an increase in oxygen consumption. There's an increased contribution of carbohydrate to oxidative metabolism. So early in pregnancy, carbohydrate becomes the preferred energy source, resulting in increased uptake of glucose. So especially for women who may be taking insulin, or for women who have diabetes in pregnancy who are taking insulin, there is an increased likelihood for hypoglycemia. And in addition, there is possibility that less exogenous insulin may be needed. However, as the pregnancy or the woman is exercising consistently for a period of time, her body adjusts, and there can be an improved fasting blood sugar after 6 weeks of exercise. So early on in pregnancy, there's actually an increase in insulin sensitivity. In weight-bearing exercise such as walking, the energy required progressively increases with an increase in weight during the course of pregnancy. Pregnant women use carbohydrates at a greater rate both at rest and during exercise than do non-pregnant women. And as the pregnancy progresses, later in pregnancy, there begins to have a decrease in insulin sensitivity, and this is especially when we see women who are screened for gestational diabetes, typically between 24 and 28 weeks. In obese women, carbohydrate oxidation is decreased, and there is a decrease in insulin sensitivity. So this is why exercise will be so beneficial this period of time, because it actually helps to increase insulin sensitivity. Some other physical changes that occur is there's an increase in core temperature, especially with increased duration and environmental temperatures. There's an increased water loss, dehydration, women who are pregnant at higher risk of dehydration. And also there's an increased energy expenditure, as we mentioned, with increasing weight as the pregnancy progresses. Also, the basal metabolic rate and therefore heat production is increased above non-pregnant levels. An increase in body temperature during exercise is directly related to the intensity. So the higher intensity women may be working, there's an increase in likelihood of increased body temperature. If the heat production exceeds heat dissipation capacity, for example, during exercise in hot, humid conditions, the core temperatures continue to rise. And especially in areas of the country where heat is also associated with high humidity, this can be very dangerous. Fortunately, pregnant women regulate their core temperature very efficiently. Increased blood flow to the skin and expanded surface releases the increased body heat. So with any kind of recommendations that we make as far as exercise and related to some of these changes that occur, we want to avoid maternal contractions, premature labor, decrease in fetal heart rate, any fetal distress, low infant birth weight, and dangerously increased fetal temperature. And although there have been no reports that hyperthermia associated with exercise is tetragenic in humans, we still want to be very, take the precautionary side when making recommendations. And also because there is a potential risk of overheating if exercising vigorously in high heat, we advise women to avoid exercise in hot, humid conditions and to stay hydrated at all times. Fortunately, trained women are much better at dissipating heat. However, I find that most of my patients that I see are not in a trained condition.